So I want to take a little more time and really talk about the intricacies of the cost of healthcare in the United States because, like we were talking about on this previous slide, the U.S. requires its citizens to have private health insurance, which we have to pay for out of pocket. If you're fortunate to have an employer that will pay a portion of that for you, you're very privileged. But like we talked about, many employers, especially for jobs that are typically associated with lower socioeconomic status, do not offer health insurance to their employees, which means that it becomes the individual's full responsibility to find and pay for private health insurance. Like we talked about, the average premium in Texas is $440 a month for health insurance. That's what you pay per month. And again, that doesn't mean that everything is free after that. You still have things like co-pays and deductibles, pharmaceutical drugs, prescriptions that you need to fill, etc., that you still have to pay for out of pocket. That premium is just the monthly baseline that you have to pay with private insurance. And it's $440 on average here in Texas, but that varies from state to state, anywhere from around $250 upwards of $800 in some states for the average premium. So you can see how expensive private health insurance can be for people, and how expensive health care and health coverage in general is in the United States. Now, it's important to really emphasize how expensive health coverage is in the United States, specifically because of our private healthcare expenditures. The US spends more per capita on healthcare than any country in the world, right? So you'd think, since we spend so much money on healthcare, we should be extremely healthy. I mean, the amount of money that we spend per capita on healthcare is through the roof in comparison to other countries, right? This probably isn't very surprising to you now, because as we've looked at so many different issues around the US, things like crime rates and education quality, right? The US consistently performing very, very poorly on all these national measures. Healthcare is no exception. While we spend an astronomical amount per capita on healthcare, we are only the 35th healthiest nation in the world. 35, right? And like I said, you would think, oh, well, we spend so much money in healthcare, the United States must be the healthiest country in the world. That's far from the case here. So while we spend a lot on healthcare, it does not mean we are receiving superior health services. All it means is that we're paying out the ass for them, right? We pay so much for them. And the vast majority of our healthcare costs, the reason why healthcare is so expensive in the United States is that because through private insurance companies, we end up spending billions of dollars a year just paying for administrative costs. Because health insurance, if you've ever gone to the doctor, you know how health insurance works, right? Your doctor bills your private health insurance company. Your private health insurance company determines how much of whatever your healthcare costs they will or will not pay for, and then everything else gets billed directly to you. So we're essentially going through a third party to pay for our health insurance. Whereas a number of countries around the world that have public healthcare coverage, things like universal healthcare, all healthcare costs go straight through the government. So your healthcare costs when you go to the doctor gets billed through this public system that's associated with the federal government. So you're really just cutting out the middleman. And that's where these countries are saving billions of dollars, is because they don't have to pay the administrative costs that are associated with countries that require and rely on private health insurance plans. So let's just take a look here and again compare the United States and what we're spending per capita in comparison to other countries in terms of healthcare. So these funds here are just looking at private healthcare spending. Okay, so this is what private healthcare spending we are spending in the United States, $4,500 per person. So that means on average, each U.S. citizen spends $4,500 a year paying for their private health insurance and healthcare through their private insurance. All right. The next country that even comes close to us is Switzerland, and as you can see, they're spending less than half of what we're spending in private healthcare, and Switzerland is still even high. The next closest country after that is Canada, and they're only paying about a fourth of what we're paying, right? So you can see how all of these other countries comparatively spend significantly less in terms of what they're paying for private healthcare spending in comparison to the United States. So this should be the first red flag for us, right? If we're not if we're not the healthiest country in the world, but we are spending a significantly higher amount on private healthcare spending, it should be an indicator to us right, that maybe this private healthcare format that we're using is not the best way to receive the best health results for our nation. So with the private sector playing a big role in U.S. healthcare, it's not surprising that the U.S. spends over 5 times more on private healthcare than the median or the average country. So you can see the median, which is just a measure of central tendency use. So it's essentially like saying the average cost that countries spend for private healthcare per capita is only $806. So we're paying over 5 times that amount, right, in the United States. So like I said, should be a red flag to us. Even more so when we take into consideration that in addition to having that high per capita expenditure for private healthcare spending, the United States still has very high per capita public healthcare spending, right? So this public healthcare spending is what we on average pay as a US citizen each year to fund our public healthcare funding. So specifically what we pay to fund Medicare and Medicaid predominantly, right? So like we said before, Medicare is this public health care coverage that we do have in the United States that specifically provides health care for people over the age of 65. We also have the Medicaid system, which is designed to help provide affordable health coverage to people that are living in poverty. But again, you need to apply for that. It's not just automatically granted to you if you fall below the poverty line. It's a very complicated system to navigate. So you would think that if we require citizens to have private insurance in the United States, we saw how much per capita we're spending on private healthcare coverage, you would think that we as a country would probably pay significantly less in terms of public healthcare spending. But surprisingly, here we see that's not the case. We still are spending so much money in public healthcare spending. So where is all this money going to? What are we spending all this money on? And like I said, what studies are consistently finding is that it's the administrative fees that we're getting bogged down with, having to mess with private health insurance companies that are very costly. The other thing is that when we have private healthcare companies, it allows them to compete with one another in ways which can be healthy competition, right? And meaning that some people may offer lower premiums or lower deductibles to entice different people to buy into those plans. But what we're kind of seeing in health insurance is that they've really monopolized the market, right? So the big healthcare companies have decided, hey, we can make people pay this much for private insurance, and since they need private insurance, they're going to pay that, right? Now, what's interesting to note here is that with the exception of the United States and Denmark and Japan, all of these other countries listed here with these high public healthcare spendings offer universal healthcare. So this is where all their money is going. They're using these public funds to pay for universal healthcare or universal health insurance for all of their citizens. So here's the kicker. Not only does the US spend the most on private care, it also spends more than the average country on public healthcare as well.